Hi, Miss Smith. My name is Ashley. I'm going to be taking care of you today. I'm going to go ahead and close the door for privacy. I'm going to wash my hands. I'm going to go ahead and put on some gloves. Okay. Miss Smith, can you tell me your name and date of birth? Susan Smith, 5'5". That is correct. With your armband, do you have any allergies that I need to be made aware of? No? Okay, great. So the provider, according to your x-rays, has found that you do have a bowel obstruction. So that's been what's kind of been causing your symptoms. So what he wants to do is he wants to go ahead and put an NG tube down. It's a flexible tube that goes in your nose and it goes down to your bowel system to help drain that off and help relieve that for you. Is that okay? Okay. All right. So the first thing I'm going to do is I'm going to go ahead and I'm going to drape you. So I will let you know that this procedure is not very comfortable. So at any time during it that you start feeling uncomfortable, it starts hurting or anything like that, you can tap me on my arm and I will stop and give you a minute and then we can proceed after that, okay? Also, another thing that I need to let you be aware of is I'm going to be monitoring your oxygen during this entire procedure. So I'm going to go ahead and put a SAT on you. I'm going to check your respiratory rate, your heart rate, and your O2 sats before I ever start. The reason being is if for some reason this tube goes down into the bronchial airway, I would be able to see it on that SAT during the procedure, okay? So next I'm going to go ahead and I'm going to hand you some water. Whenever I instruct you to, I'll have you take some small sips and that will help just guide that tube down where we need it, okay? So another thing I'm going to do is I'm going to go ahead and I'm going to take some tape to where I can secure this once we get it in place. So I'm going to take 2 pieces and then for my third piece, I'm going to make what looks like pants. So like this, okay? And that will secure the NG tube to the nose. All right, so I'm going to go ahead and get those ready. All right, next thing I'm going to do is I'm going to go ahead and clean the nose, and that will remove any kind of oil from the nose so it will stick properly. Okay. I'm going to go ahead and put some lubricant out to where I can lubricate my tube. That way we can get it going in the correct direction and help with it moving down. All right, so there is a few things that I would like to ask you before we actually start this procedure. So have you ever been told that you have a deviated septum? No? Okay. Have you recently or at any point been on any type of anticoagulant? So any type of blood thinners, Coumadin, Xarelto, Eliquis, anything like that, or been taking NSAIDs, which is like ibuprofen on a daily basis? No? Okay, great. Have you had any kind of trauma to your nose that I need to be aware of in the past? No? Okay. All right, so good. I'm gonna go ahead and I'm just gonna inspect the nasal cavity. I am looking at both nares to make sure that I don't notice any kind of deviated septum, notice any nasal polyps or any kind of obstructions that's gonna cause a problem whenever I do drop this tube, okay? So the first thing I'm gonna go ahead and do is I'm gonna measure this tube. So the way you correctly measure this is you are going to start at the tip of the nose. You're going to hold it taut and go to the tragus of the ear. Okay, holding it taut here and dropping it to the xiphoid process, which is right at the base of the sternum. Okay, so I have a measurement of 48 centimeters for this patient. So I'm going to take and place just a small piece of tape here at the 48. That way I know once I hit that 48 that I am in place. Okay. All right. Next, I'm going to go ahead and I'm going to lubricate my tube. I'm going to usually lubricate the distal end of that tube about 4 inches. Okay. All right. Now at this point, I'm gonna go ahead and I'm gonna have my patient lean her head back, all right? I've got my tube lubricated. All right, so whenever I tell you this is going to hit the back of your throat, you may gag whenever that happens. At that point, I'm gonna move your head down and have you take some small sips of water. All right, so I am going to go in the nair, all right? All right, you're gonna feel a little bit of pressure here, all right? I've hit the back of the throat. Okay, go ahead and take some small sips of water, and I'm going to advance a few centimeters at a time until I drop this to the 48. These mannequins don't actually drop that low, so I would just note that I had dropped it to the 48 centimeter on an actual patient. All right, so I'm not gonna move my hand at this point. I'm going to keep this hand here just in case she sneezes, anything like that. I don't want that tube to actually come out. So I'm gonna go ahead and I'm gonna take my pants. I'm gonna put the top of the pants at the top of the nose. Okay. I'm going to take the bottom of the pants and wrap them around my tube to secure it. Okay, so I have her secured now, all right? Checking her SATs. SATs look good. I'm gonna go ahead and I'm gonna get my second piece of tape. I'm gonna leave it kind of lax right here because I don't want it pulling on the nair and causing any kind of breakdown. I'm gonna tape this to the side of the cheek. And my final piece of tape, I'm gonna leave, again, a little bit of laxity there, and I'm going to go ahead and tape it to the gown. All right, now I'm gonna go ahead and call radiology and have them do an x-ray to confirm placement. X-ray is going to be your gold standard for confirmation that we have this tube in the correct placement. All right, so x-ray has come up, they have confirmed placement. All right, in the meantime, as I'm waiting for x-ray, just as a second standard, I can actually remove here. I will have a pH strip, and I will remove a bit of gastric content from this tube. And I will place it on my pH strip if I know that I am in my GI tract because of the acidity. So a GI tract will have an acidity of a 3 to a 5 on the pH scale. All right, so that is 2 forms of confirmation as far as that goes to make sure that we have this in the correct place. Now let's say that this provider has ordered for this patient to have suctioning. So I am going to remove this. I'm going to get my suction canister, and I'm going to connect this patient to low intermittent suction and make sure that my suction is appropriately withdrawing fluid here. Okay. Now, let's say that this patient, instead of receiving suction, that they were going to be getting NG tube feedings. So a standard that I need to do every 4 hours is I'm going to come in with a measuring cup with actual measurements on it. I'm going to, every 4 hours, remove the residual from this patient. So that means I'm going to withdraw all of their stomach content out and measure that. If I have 250 or less, I'm going to return that feed back to the patient they are appropriately absorbing. If I have greater than 250, my bowel isn't working as appropriately as it should. So anything from 250 to 500, I am going to stop my tube feeding. I'm going to call the provider, and I'm going to expect an order for Reglan. Reglan is a promodal medication, and it helps the bowel to start waking up. All right. Anything greater than 500, my patient is not absorbing at all. So at this point, I am going to stop the feed. I'm going to waste the feed that I have, and I'm going to notify the provider, and again, expect Reglan. Okay. All right, thank you, ma'am. I'm going to go ahead and clean everything up, and I hope you have a wonderful day.